Well, there's been more evidence today of the unbelievable impact that COVID-19 has had on our society and how many people it's taken from us. The insurance company Discovery Life says that of the death claims it paid out last year, 60% of them were deaths from COVID-19. I'm sure this was the third wave. Gareth Friedlander is the Deputy Chief Executive Officer at Discovery Life. Gareth, good day to you. How big was the number of death claims that you received during the pandemic?
Thanks, Stephen. Yes, certainly some chilling numbers there. We saw our death claims up last year in 2021 by 173% relative to 2020. So that's almost tripling the number of we paid in death claims last year. And as you said, it accounted for 60% of our deaths. So that is, you can add up all other causes of deaths combined, and it's still about 50% more were COVID deaths. So quite unbelievable numbers.
I mean, in the history of your company, has there ever been one thing that caused so many deaths? It's a huge figure.
No, certainly not. As far as our data shows, there's been nothing even close to this. Obviously, heart and arteries, cancer-related claims tend to be large, but nothing's ever been of this magnitude where it's tripled deaths from one year to the next.
It's not just deaths that came from COVID-19. People lost income as well. Sometimes people left behind children. There were insurance policies for their education. Did you see a large number of claims like that?
Yes, we did. Obviously, the largest amounts were relating to deaths, but we also did pay an enormous amount under income replacement benefits, as you mentioned, of about 64 million rand. Severe illness benefit as well for clients who were heavily impacted by COVID-19. And then, as you mentioned, we've got a benefit which we call our Global Education Protector, which really covers children's education if one of their parents pass on. And we had 64 such cases last year where children or young children whose parents passed away from COVID-19, and we'll now be covering their full education until university.
There's been a lot of discussion around mental health during the pandemic, and absolutely correctly, and I suspect, and certainly the psychologists I've spoken to say, we haven't actually even begun to realize the impact this has had on us. Do you think you'll still get more claims from what I would call associated trauma, both financial and mental, from COVID-19?
That's certainly a trend, Stephen. We are seeing that on the increase. If you look at suicides, we're up 18% from last year and up 25% when you look at the last 4 years relative to the 4 years before that. So certainly trending in a worrying direction. And we've paid over 400 million last year for mental health related deaths. So that is a concern, and it's certainly something we're focusing heavily on to try and ensure that we can address mental wellness.
So just to understand, there's been a higher number of suicides this year. You mean this financial year? So during what I would probably call the third wave of COVID, rather than actually during the height of the pandemic. What I'm trying to get to is, it may well be that we only get the true cost to our mental health a year, 18 months, 2 years after the pandemic.
That's true. We reported on the calendar year 2021, so during 2021 it went up 18% from 2020. But as you say, the impact on mental health of all the loss of the pandemic and the associated lockdowns, both kind of personal loss as well as financial loss, could well be only coming through in years to come. So worrying trends from that perspective.
So as you say, nothing like this has happened in the history of your company in insurance. As I understand your business, you'll know your industry a lot better than I will, but as I understand it, insurance companies are themselves reinsured. In other words, the cost is sort of passed on from company to company. Basically, the entire insurance industry there's a reinsurance industry that reinsures itself. When you look at what's happened to your business, what's happened to other businesses around the country, a once in a century event, let's hope, has this had a big impact on the insurance business around the world?
It certainly has. It's had a big impact on the entire industry, the reinsurance industry, and you know, even the way that you're reinsured, it doesn't necessarily cover you to the extent that you need to be for an event like COVID. So there is some cover from reinsurance, but certainly a big hit on the entire industry. But I'd argue that that is also the industry showing its worth. You know, the relevance of life cover has never been more important than it has been over the last over the last 2 years, and it really, the industry has come to the fore. We paid 11.8 billion to our clients last year alone, up almost doubling from the year before. So real help during tragic times that we've seen over the last couple of years. And then something else that we obviously focus on very heavily is the shared value model, where we try and incentivize clients to be healthier. And we've seen that health and wellness has been more powerful than ever before. So for clients who've engaged in the Vitality program and engaged in health and wellness, they've actually had 85% lower death rates than clients who haven't been engaging, and that's related to COVID-19. And they're also rewarded through what we call our payback benefit, which we paid 1.3 billion rand last year to clients just for being healthy.
Gosh, get up in the morning and go for that walk, even if that's all you do. Gareth Friedlander, thank you, Deputy Chief Executive at Discovery Life. I really do appreciate the time.